So this is a video demonstration of administering IV fluids to a client who has been vomiting during labor and needs some rehydration fluids. So I have begun by just gathering all my equipment. I have clean gloves, I have an IV start kit, two 20-gauge IV catheter needles, IV solution, that I have made sure that it is in dates and that there's no sediment, the fluid is clear. And then I've got my IV tubing, and that is where I'm going to start by priming the tubing. So that cap's covered. I'm going to make sure it's locked. Removing the tip here, keeping that sterile. Also removing that tube. And we are going to put those together. Okay, so it's punctured the bag. Okay, now I'm going to squeeze the chamber until we get it about, a third of the way full. And next I'm going to open the tubing to allow for it to flow through until we get to the very end here, and there it's all filled with the fluid. There are no bubbles, and I've got it locked again. Okay, and then I will just hang it to the side for now. Okay, now I've explained the procedure to the client. I've got their arm set up here on this Chuck's pad, and we are going to begin. I'm going to start by washing my hands again, putting on clean gloves for this first part. Going to open my IV start kit. I'm going to take out the tape and get a few pieces on the edge here, ready for when I need them. And then this one I'm going to actually tear down the center. Okay. Tape's ready. Then I'm going to get the tourniquet and attempt to find a good vein. So put this tourniquet on nice and tight. Maybe have the client squeeze their hand to pump up a nice juicy vein. And I see one. I'm going to get my sterile gloves out and set them right there. That is the tegaderm. Here is the, I'm going to pull out the alcohol swab and the providone iodine swab. And I'm going to use the providone iodine first, if I can open it. Oh my gosh. Is there a notch? There's a notch. Got it. Providone iodine first. Trash. Cleanse the site. Circular motion, inside to outside, 10 seconds. And then I'm going to do the same with the alcohol prep pad, which clears off the providone iodine so I can see the site better. Inside to outside in circles, about 10 seconds. Okay, and then I can, maybe should have released the tourniquet before I cleansed the site. Then I can throw away my clean gloves. And I'm going to wash my hands again. And I'm going to open up my sterile gloves. Get the IV catheter needles up there. Okay, and I'm going to tie this again actually real quick before I put the sterile gloves back on. So tourniquet's back on nice and tight. And get the sterile gloves on. And second sterile glove. My IV catheter needle is already open, so I can just pull that right out. Okay, I'm going to take the cap off into the trash and applying some traction with my non-dominant hand onto the vein to hold it steady. And I've chosen a vein that's further down the arm rather than up higher on the arm, because if this spot doesn't work, then I can move up the arm to another place. So see the vein, I've got traction on it. 15 to 30 degree angle, I'm going to insert the catheter needle. Watch for flashback, got flashback. So then I'm going to lower my angle and insert just a little bit further to make sure I'm in the vein. I'm releasing the tourniquet. I am going to advance the catheter. Okay, catheter is advanced till the bevel is just about skin level. I'm going to retract the needle and then immediately put pressure on the catheter to prevent bleeding. I'm going to put this in my sharps container, grab my IV line, remove the cap, and connect the tubing. Okay, so that is connected, and I'm not taking my hand off it yet. I am going to start the IV fluids, and I'm going to watch to make sure that the line is patent. I'm going to watch to make sure that there is fluid dripping through the drip chamber, as well as no swelling around the insertion site. Okay, and as it opens up, there's no swelling around the insertion site. Drips are flowing. Okay. So now I can secure the catheter, the IV catheter. Okay, so I'm going to start with this there, and then this over top. Okay, and then I can put the clear tegaderm on top of the site. Okay, make sure that's completely sealed. Remove this outer edge, maintain the seal. Okay, and then I can loop this around and again secure it with another piece of tape so that it doesn't get snagged and come off. And then I can remove my gloves, clean up, make sure that I document the procedure and the results.